Thanks for joining us for 5 on 5. I'm Joe Sullivan. Pleased to be joined today by Troy Cribbins, Board Chair, Bay Area Hospital in Coos County. Troy, thanks for your time.
My pleasure. Thank you for having me.
Last month, KOBI News reported Bay Area Hospital has been facing difficult financial issues, including defaulting on a $47 million loan. Please update us on where that stands now.
Well, and that's correct. I would preface it a little bit by saying it's not just Bay Area Hospital. Hospitals across the state, as well as across the country, are undergoing significant financial difficulties. Our hospice in specific has a $46 million loan, and we have on paper gone default. We have not yet missed a payment, and we are striving and have been striving for almost 2 years to find a long-term solution to solving the financial difficulties of our hospitals in order to maintain all our critical resources here and service of our community.
What would you say the top priorities for Bay Area Hospital are right now, and how's the board working to move forward toward those goals?
Well, as I said, we've been working for 2 years to try to find a long-term solution. We've looked at a local, smaller health system, affiliation with local partners, which really wasn't an answer. We looked at floating a bond, which again was not really a long-term answer and would put increased burden on our citizens. And we've looked at many different things. Our executive team has gone through significant financial tightening and finding, turning over every rock to help solve the problem. But the problem is really fundamental. The problem is that over the last 4 years, we've increased probably 40% increase in costs, while in that same time period, our reimbursement rates from our primarily government payers have increased maybe 1% to 2%. That is not sustainable. What the market is telling us is that for smaller rural hospitals, being affiliated with a larger system in order to spread those costs out is the best way to maintain long-term viability for your hospital. And that's what we're currently working on right now, is a affiliation agreement with a large health system.
What large health system are you talking about?
We are working on an agreement with Quorum Health. They are a hospital management company out of Tennessee, and their region is kind of, I'd say, kind of west-southwest. For reference, they own McKinsey Willamette and have since 2016. And that's who we are working on a partnership with.
Beyond emergency care, how involved is the hospital in broader community issues, health issues like mental health, addiction, or prevention programs?
We're actively involved in both of those. We have one of the only mental health facilities, an inpatient hospital in the area. I will say it has its own issues as well. But those are, again, a much bigger topic, from the state and federal level, because it's not being used correctly. The patients that are supposed to be there 7 to 14 days in order to get stabilized and then transfer to a more longer-term location to help them work on their issues. Sometimes we have patients that are stuck in those units for months at a time. That's not helpful for that patient, and it's not helpful to our staff or our providers. We're also involved in what we have as the Kids Hope Center in our area. And they perform, that's one of those agencies that you wish wasn't there, but you're awfully glad they are. They do child abuse cases. They take the kids in, they do interviews, and they get them in a safe spot and help them move into a different direction.
All right, we'll take a quick break and be right back with part 2 of our 5 on 5. Stay with us. Welcome back to part 2 of our 5 on 5. We're talking with Troy Cribbins, Board Chair, Bay Area Hospital in Coos County. Troy, transparency is so important in healthcare. What's your approach to keeping the community informed and engaged with what's happening at their local hospital?
Well, from the onset, all our meetings are public meetings, and they're noticed, and we welcome the public to show up to our board meetings, as well as our finance committee meetings and our quality meetings, and that's encouraged along the route. Early on in this process, we heard from our community they were not getting enough information. So we've opened it up to several open houses at the hospital where we're just an open forum for people to ask questions. The CEO, Brian Moore, and myself have participated in other public forums, including the League of Women Voters. and all in an effort to try to make sure that we're communicating with the public what the hospital is working through and how we're striving to maintain a vital, healthy hospital in our community.
Is there anything else you'd like our viewers to know about?
Yeah, I think that I would like the viewers to know that we understand that many communities are struggling. And in my day-to-day job, I have access to patients and I see the difficulty they have accessing care on a regular basis. And our role and our mission is to make sure that Bay Area Hospital stays here and vital and is able to provide the services our community has come to depend on, not just for us locally, but for our region. We're a fairly geographically isolated region, and people from Gold Beach count on us. People from Reedsport, Myrtle Point, Coquille, Bandon, they all depend on us being here. And it's our goal to make sure that that does not change and continues moving forward, regardless of what the healthcare market looks like.
Troy, thanks for taking time and telling us more about Bay Area Hospital.
My pleasure. Thank you. Anytime.
Stay with us. We'll be right back with more local news.